Hi everyone, I'm Dr. Amrika Sheshadri, plastic surgeon, and I want to kickstart the next part of breast reshaping procedures. Today I want to talk to you about axillary breast. What is axillary breast? So axilla is the armpit. It's like a really fancy Latin way of saying armpit. And this is important because the armpit is between the arm and the chest. So in our species, in the human species, both men and women have breast tissue. Men don't really produce any milk with their breast tissue, so it's largely redundant. Women produce milk when they are lactating and they're feeding their babies. So men and women of our species have breast tissue from the center of our chest all the way to the armpit. In fact, the bit near the armpit is a redundant part and it is called the axillary tail, and it's named after someone called Spence. So it's called the axillary tail of Spence. This is an absolutely natural part of our body and most of the times it's no trouble. When does the problem arise with axillary? It's when, for whatever reason, so there are two main reasons this happens. One is hormonal fluctuations not related to pregnancy. So women who have never given birth, who are post-pubertal, that is to say they are above the age of 14, and then they haven't yet had a pregnancy or they've never yet breastfed a baby, and this bit increases in size. Why does this happen? Is because breasts, like I told you in my first video, breasts are very, very sensitive to hormones, and if the breasts get a signal that increase in size, it doesn't differentiate if it's supposed to increase only in the center mass or in the armpit area as well. So the armpit fat, it's not just fat, it's breast tissue contained within that fat, and it's part of the natural breast tissue. And there's usually a band that separates the armpit area from the true breast area, which is why you get a typically dumbbell shape. Like this is what that image will show, and it's like a dumbbell shaped structure. So let's say that the swelling was uniform, that the breast enlargement was uniform, it would not look so awkward. But the very fact that that restraining band divides it up into like one segment here and then one segment there, this is what gives axillary breasts that peculiar side breast sort of picture. There is no medical cure for this because this is tissue that it's not just fat. So if it was just fat, then a bit of weight loss could have helped with reduction in size. But this is fat captured by breast tissue, similar to the mechanism what you see in gynecomastia. I've linked that video down here as well. Once breast tissue captures fat, it lets go of that fat very reluctantly. So it's not like you can persuade that fat and breast tissue to shrink. This is the first kind. The second kind of axillary breast enlargement happens naturally during breastfeeding. So all of the breast tissue enlarges, and for whatever reason, the armpit fat or the side breast refuses to shrink after the breastfeeding phase has ended. So it got the signal to increase in size, but it never received the signal to shrink down back to its original size or what was intended size. So these are typically the patients who have stretch marks along their side breasts, and the amount of retraction they get even after procedure can be a little plus or minus. The number one query I get about this is this cancer? So just with the clinical examination, it's very hard to determine if something is cancer or not cancer. But suffice it to say that the incidence of cancer occurring in the axillary breast is about the same as a normal risk of breast cancer in women. So just because you have an axillary breast enlargement does not mean you're going to end up with cancer. I mean, there's no direct correlation there. Why do these occur on one side more and one side less? A lot of it has to do with handedness. So if you're right-handed, it's more likely that you'll notice the one on the right side more. It's usually both sides. So there is no such concept of a unilateral or a single-sided side breast enlargement or an axillary breast enlargement. It's usually bilateral, which means both sides. Like Indo-US talk bilateral, so bilateral, both-sided. It's just that people who are right-handed tend to notice the one on the right-hand side a bit more, and so therefore they feel that one is a little bit bigger than the other. So in my next video, I'm going to talk mainly about how is it that I specifically treat axillary breast, and what does a typical before and after look like, and what is your recovery journey typically like. So I hope that you found this video informative, and I would love to hear your comments down in the comment section. And as always, take very good care of yourself, and I will see you soon.